This is, I believe, is a very important hearing. A lot of moving parts in our economy, certainly across the country. I represent a constituency in Nebraska, and some of the states around us. We've had fairly strong economies throughout a lot of this time, although we're still affected by the weaker national economic recovery that we've experienced the last 7 years. Dr. Holtz-Eakin, you've done a lot of work on the Obamacare, ACA, whatever one wishes to call it. Nebraska had the first collapse of Co-Opportunity Health, it was called, the first of the community-oriented and operated health plans created by Obamacare. That was the first to collapse. 11 additional co-ops have collapsed out of the 23 created, and obviously that has an impact, leaving a lot of folks without the coverage that they were promised, or perhaps they were moved over to that against their preferences. But now we also have reports of major insurers such as United Health and Humana leaving the health exchanges, and I would say these are major losses and certainly contribute to what seems to be a growing dissatisfaction of the outcomes of Obamacare. And I was just wondering if you might comment on what we might expect economically or other dynamics out there as a result of these newer developments in Obamacare.
I think there's good reason to be nervous about the stability and future of the exchanges under the Affordable Care Act. The reality is that enrollments grew however quickly you might want to think and then have just leveled off. We know that the people who buy health insurance first are those who need it the most, and the insurers' losses have proven that this is an expensive population, more expensive than anticipated. The co-ops, who had the dual handicap of being highly inexperienced and using someone else's money, bad incentives always, have gone out of business on those losses. The major insurers, the Blues and others who've done this for a long time, are losing money in a big way. And the future is sort of in doubt. One possibility is these are simply, they're going to try to raise premiums in the traditional fashion and drive people out of the exchanges, and they go into a death spiral. I doubt that Congress has the appetite to throw more money in and just turn these into glorified high-risk pools where expensive people get subsidized to get their care. I think it's a deep concern. It's a budgetary concern, it's an insurance concern, and it's certainly a health care concern, because when people lose their insurance, as they did when the co-op collapsed in Nebraska and Iowa, they have to change provider networks, and this is always a bad thing for outcomes. So we're not in a good situation, and it's not obvious what the next step's going to be.
So from a consumer standpoint, what do you think consumers should see on the horizon? Perhaps any changes that they should expect or try to plan around?
The thing they face most imminently is higher premiums. I mean, these insurers are losing a lot of money. There is no other place to go than to raise premiums. So we've seen sharp premium increases already in the benchmark silver plans, and we've seen the kinds of disguised premium increases that come with narrower networks, higher co-pays and deductibles. That's the imminent threat. The bigger problem is insurers leaving. United has said they may leave. Aetna is talking about leaving. That diminishes their choice. There's a lot of evidence that with diminished choice comes less competition and higher premiums yet. So this is, in my view, whatever you thought of things when they first passed, it's not evolving in a very beneficial way for consumers in the individual market.